Welcome back to the Business Spotlight. We have Dr. Mary Swift talking about DaVinci Veneers. And as we promised, we're going to talk about the process of building a healthy smile as well as a beautiful smile. So we have some before and afters from your website again, some real life cases of yours that I would like to share with our studio audience and have you explain to us everything that's involved in creating these beautiful, healthy smiles for them.
That'd be great. This patient was about to enter the workforce for the first time, graduated college, and he had spacing between his teeth which made for a more juvenile smile. We think of little kids with spaces. So he wanted to have his smile match his position in life, so we matured his smile and brightened it by putting veneers on his front teeth, whitening the lowers, and doing a little bit of gum contouring. You can see how there's less gum showing in the after picture.
I had never even considered gum contouring. So do you do that quite a bit as well?
It should be as important as the tooth, gums and teeth, all in the picture.
Great. And then you have a client, a before and after picture that I find really fascinating as well. And I believe this person you actually used Invisalign with first?
That might be coming up. This particular before and after involves dental implants, bridge work, and veneers. This was a full mouth rehabilitation. In other words, we worked on every single tooth in his head. We had to regain function as well as aesthetics. That was a quite involved case.
So remind us again, what would happen if you didn't do this foundational work with the veneers? Yeah. If someone just came in and said, I want veneers, I want only veneers,
right.
what might be the outcome?
And the outcome would be veneers not lasting very long. And the outcome from that would be the public not trusting cosmetic dentistry. So as a mission,
you have a mission.
I have a mission. You always have to have good tooth alignment. In other words, the top teeth and the bottom teeth should meet in a way that is not traumatic to any work that's placed on top of it. So long story short, fix the foundation with a little bit of Invisalign to get things in an ideal position. We can do only so much with porcelain, you know, before it overreaches the goal or its capabilities. Yeah. So getting things in alignment, in a better position with Invisalign, whitening, because a lot of times we will put porcelain on the top. Well, if the bottom is a whole different color, that's not going to look natural. Right. So whitening. Again, with the gums, you have to look at length to width. Are the gums at the same level on the two front teeth? I don't know if you've ever seen someone looks like all they have is a big front tooth because the gum is a different height. And then from there, you actually look at face proportions. The face is divided into thirds, and where is it's a mathematical equation along with physics for directional forces, along with cosmetics for a good eye for what should happen. Yes. Lots of experience, lots of cases that have been done that you know will work. All of that adds up to a better outcome for the patient. But you do have to look at the whole picture, not just the front 6 teeth.
Now, one of the things we talked to, I don't think we covered, but I think it's important, is how long should veneers last?
A lifetime.
A lifetime?
The number one reason for patients switching out their porcelain is gum recession. So over time, as we age, our gums do recede. When the gums recede, then a little bit of the edge of the porcelain will show, and so in order to scoot that back up underneath the gum tissue, patients will have their veneers switched out.
For some reason, I was thinking that they needed to be replaced more often than that. So, you know, the work you do just provides so much for so many people. How long is a typical treatment plan when someone comes in to visit you?
First and foremost, health, as we've talked about. So we have to make sure the gum and bone are in good health. So there's usually a series of x-rays to check the gum and bone health and for decay. So we clean things up, get everything healthy, and then you can start with the pretty. So, you know, usually if somebody walks in and they've had good dental preventive care and they're coming to my office for just veneers, the icing on the cake, that should be a turnaround into appointments.
Right.
Okay? But if we have to establish health first, that'll take a little bit longer, but well worth it and should never be ignored. Always take care of health before beauty.
Absolutely. So if I were looking to have veneers or to have some cosmetic dentistry done at your office at Dallas Laser Dentistry, what would be the steps that I would take?
Pick up the phone.
Pick up the phone, give you a call.
Give us a call.
At 214-736-4697. And your receptionist will answer the phone?
She will. And like I said, the public will notice from that first phone call why we are who we are. We research your insurance for you. A lot of offices won't do that. We will try and optimize your appointments. I've been with practitioners, dentists who believe in multiple visits before anything is done. You know, people are busy these days, you know, so we try and make sure that we economize and optimize everybody's time and be respectful of their time and get the job done.
Absolutely. And consultations are free.
Consultations are free. Second opinions, I welcome, because if your little red flag went up and you want to know whether what's going to permanently change in your mouth is what needs to happen and you're not so sure, please call. Please call.
Well, if you or someone you know has been looking to whiten, brighten, or have a healthier smile, do yourself a favor and call Dr. Mary Swift at Dallas Laser Dentistry. Her phone number is 214-736-4697. You have nothing to lose, everything to gain, a smile that will bring you attention and everything that you've been looking for.